Hello everyone, today we'll be discussing about the conscious sedation, the indication, contraindication, and finally the procedure of administration of the nitrous oxide. So let's begin with the definition of the conscious sedation. A minimally depressed level of the consciousness that retains the patient's ability to maintain the airway independently and respond appropriately to the physical stimulation and the verbal command by the ADA 90. So the indication involves fearful, anxious patient for whom the basic behavior guidance technique have not been successful, patient who cannot cooperate due to the lack of the psychological or the emotional maturity and or the mental, physical or the medical disability. Similarly, patient for whom the use of the sedation may protect the developing psyche or reduce the medical risk. If it reduces the psychological trauma, then it is indicated. In contraindication, the cooperative patient with the minimal dental needs, the predisposing medical condition which would make the sedation inadvisable as follows, like hypersensitivity to the agent, chronic obstructive pulmonary disorder, psychiatric patient, cardiac patients, epilepsy and the bleeding. So the procedure for the administration of the nitrous oxide. The nitrous oxide must be administered only by the appropriately trained individuals or under the direct supervision. Very important in the procedure for effective conscious sedation is the acceptance of the nose piece by the patient. If the patient exhibits the resistance, then this method is not advised for such children. Informed consent must be obtained from the parent and documented in the patient's record prior to the administration of the nitrous oxide or the oxygen. The practitioner should provide the instruction to the parent regarding the pre-treatment dietary precautions if indicated. Similarly, this requires the explanation at the younger's level of the comprehension, a slow approach and the behavior shaping with the positive reinforcement throughout. The sensation which the child is going to experience should be explained to the child before and during the procedure. The selection of appropriately sized nasal hood should. So the procedure here involved are the thorough inspection of the equipment, place the mask over the nose, bag is filled with the 100% oxygen and delivered to the patient for 2 to 3 minutes at the rate of 5 to 6 liters per minute. Then slowly introduce the nitrous oxide. The titration of the nitrous oxide in the 10% intervals. The concentration should not exceed the 50%. The nitrous oxide concentration can be decreased during the easier procedures like the restoration and can be increased during the extraction or the LA injection. 5 is encourage the patient to breathe through the nose. Explain the sensation to be felt like the floating, gibby, tingling of the digits. Then adjust the concentration to 30% nitrous oxide and 70% oxygen. Carry out the procedure with the continuous monitoring. After the completion of the procedure, give 100% oxygen for 5 minutes. And finally, 10 number, the patient must return to the pre-treatment responsiveness before the discharge.